Good morning. Welcome everybody to this morning's Urban County Policy Board meeting. We have a large size agenda today, so we will go ahead and get started with that. And we'll start with introductions. Rebecca, is there anyone in the room?
There is no one besides staff in the room.
Okay. Would you like to go ahead and introduce yourselves real quick?
Good morning, Rebecca Royce, Program Coordinator, Staff to the Board.
Noreen Ibrahim, Program Assistant for CDBG and Home Funding, Staff to the Board.
Good morning, Michael Torres, Program Manager, Clark County Community Services.
Great, thank you. I'm Glenn Young. I'm Chair of the Urban County Policy Board and serve on the County Council. And Rebecca, go ahead and just ask people that are virtual then at this point.
Good morning. We'll start with board members. Councilor Ferrer.
Councilmember Ferrer from Battleground. Good morning.
Miranda Lang. We'll come back to Miranda. Lauren Hollenbach. Lauren Hollenbeck. How about Miranda Lang? They are present. They may be having some audio issues. We have many presenters today for our CDBG and home application presentations, and we will do introductions of them as they come through for those presentations. At this time, we do not have quorum, so we will skip the approval of the meeting minutes.
Okay, and Rebecca, we do have public comment as item number 2.
Correct.
You want to go there at this point?
Yes, please.
Okay. All right, let's go ahead and do that. We'll open it up to public comment. Please keep your comments short and concise to the subject that we'll be discussing today. With that, I see one hand up.
Yes. Sorry. I have a question. I'm trying to find this. I'm getting blind as I get older, and I'm trying to put the agenda on my big screen at home, and I don't find the agenda online. I only see the one from the last meeting.
So Noreen sent out an email on February 2nd. It should be attached to that email.
Well, no, I'm trying to find like what citizens would see. I like to always double check how the citizens are viewing our stuff at every meeting I go to. And so, yeah, I don't see it where the citizens could see the agenda and what's planned for today under the Urban County Policy Board meeting. All I see is for 112. I have only had one cup of coffee. Could somebody help me direct me?
No, apparently it looks like there might have been technical issues on our side, so we apologize for that. We will make sure that that is posted immediately.
Okay, thank you. Is that going to be a problem with the OPMA that citizens weren't able to see agendas for today's meeting?
No, it shouldn't be, because the meeting itself is posted online that shows that the meeting is available, and the agenda was provided out to the board members and to a large group of interested members in the community.
Okay.
Thank you for bringing that up. We appreciate that. So I mean, it was only not on the online portion. Is that correct? And that's not a requirement of OPMA?
I'll do additional research just to verify, but I think that it's okay. And we'll make sure that that doesn't happen in the future.
Okay. All right. Thank you. Yeah. Okay. I don't know if you guys can work on that in the background. I don't know if we can I just want to make sure that we're able to continue forward with the meeting without having it noticed that way. But we'll go ahead and move forward and have you guys looking into that in the background. So we don't yet have a quorum, is that correct?
That is correct.
Okay, so we'll save that for the end of the agenda. So then let's go ahead and move forward, Rebecca, to item number 4, which is presentations and the Q&A with the 2026 CDBG and home applicants.
Counselor Ferrer?
Sorry, I was just looking at the website, and it does say meeting agendas must be posted on most agency websites no later than 24 hours per in advance of all regular and special meetings per RCW 4230-077 and 4230-080. Just wanted to put that out there. I don't think it'd be a problem to have citizens comment while we look more into that, but that was the first initial thing that I did see on the MRFC website, if that helps guide where you can find that info.
Thank you.
And my apologies, I did forget to finish with public comment. Was there anybody at all that would like to publicly comment at this point? Okay. All right, so hearing none, then we will again move to item number 4.
Thank you. So today's meeting is primarily to have our presentations for the CDBG and home applications. Applicants have been advised to focus on the application, not their agency. They have 5 minutes to do their presentations, except for the tenant-based rental assistance program, where staff will provide an overview of the program, and then agencies and the board will then have time to do a question and answer for each of their applications. This is meant to be a very quick overview of all of the applications that we have received, which is why this meeting will be going a little bit long. We have a clock that is going for 5 minutes, so we ask that the presenters please pay attention to the clock, and when the time is up, the time of your presentation is over. And with that, we will go ahead and move into our first presentation, which is Battleground Healthcare for their dental service application. And if you'll please introduce yourself before you begin.
Hi, I'm Nancy Strebe, the Executive Director of Battleground Healthcare, and I'm ready when you are. Thank you so much. We are Battleground Healthcare in Battleground. You can go to the next slide. So just a little quick overview of who we are. We were founded in 2011. We are a no-cost free clinic that serves patients from the region, which is pretty much all of Southwest Washington, not just Clark County. But most of our patients fall below the 100% level of federal poverty. On staff, we have 9 paid staff, but a fantastic volunteer base of over 250 volunteers. You can go to the next slide. So a little overview of our most recent compilation of numbers in our dental services, which is what this application is focused on. Last year, we were able to provide just shy of $500,000 worth of services. Clinic-wide, we provided over 2,000 patient visits, half of which were dental. And we've had 7,000 hours of volunteer time clocked. Our patients come, 51% of them come from Vancouver proper, and 53% are Spanish speaking. We have a diverse set of patients that include homeless, unemployed, migrants, immigrants, and the LGBTQ community. You can go on to the next slide for me. So our dental team, overall, the core group, we have our 3 paid staff, and then We have 2 co-directors, 20 hygienists that volunteer with, 5 hygienists that volunteer with us, 20 dentists that give of their time, as well as 14 dental assistants, 25 dental students, and then of course our receptionist group of 5. We can go on to the next. We have a fantastic workforce development partnership. We are connected to these area schools of higher education that really help support the volunteer base and the services that we provide. You can go on to the next slide. So dental care was identified in 2024 as the #1 need in this county. And most recently in the Clark County Needs Assessment, it was the #2 need. We're projecting over the next couple of years that we're going to see about 80,000 Washington residents that will be losing Medicaid coverage. And an interesting way to really pay attention to that number, because 80,000, what is that? Just in 2024, all of the Washington free clinics served about 20,000 residents. So the need potentially within these next 2 years will be very significant. Some demographics about Clark County, and Clark County currently has about 125,000 residents that fall at or below 200% of that federal poverty rate. So for a family of 3, that's about $54,000 per year, not month. That was a little typo on there. $54,000 a month would be really significant. But this is why we need to have that quantity and consistency for our free dental services supported. Go on to the next slide. So some of our goals for the program between now and the end of 2027, we really want to increase the staff that we have by bringing on an additional dental assistant. We want to decrease the new patient booking window. Currently, we're booking out at about 2 months for new patients. And when you're in dental pain, that's really a long time to have to wait. We want to increase those unique patients by 10%, as well as our overall dental visits by 10%, and get to $650,000 in dental services annually. Go on to the next page for me. And lastly, I'm just going to touch on a couple of our patient stories. I think I can get one in. So Thomas there in the picture, he came from further out of town, but was in so much pain that he was removing his own teeth with channel lock pliers, came to us because his wife needed care, and then told us this story. We were able to get him seen as well and take care of some other chronic conditions he had medically that were affecting his overall health. That's all from us. Thank you very much.
Thank you. Any questions from board members?
I have a question.
Go ahead,
ahead.
Victoria.
My phone's acting funny. So I was wondering, do you have the number of like maybe retired vets that you see?
I'm going to introduce also our grants manager, who's also on the call, Ingrid. She may be better to answer that question.
Okay.
Hi there. The quick answer is we don't ask that in intake. We don't ask for vet status.
No, that one doesn't need to. It's fine.
Yeah, that's
Don't track it.
not one we can currently answer.
Okay.
Lots of other great data though.
Great. Thank you. We appreciate you coming in and giving us your presentation. And Rebecca, are you there?
Yes, so
Okay.
we did some research just to notify the board that we can move forward with the meeting, but we cannot do any action items at this meeting. So we will move the approval of the meeting minutes to the next meeting.
Great. That sounds good. And thank you again, Victoria, for pointing that out.
Thank you. Our next
And so-
presentation is from Family Solutions.
Great.
You ready for me?
Yes, please go ahead.
All right, go ahead and turn our first slide on. Thank you. Good morning. I am Tracy Arney, the Chief Clinical Officer at Family Solutions, and also joining me in the call is Lisa Carpenter, our CEO. We are excited to share with you our program that we are calling REACH, Reaching Everyone with Access, Care, and Health, which will allow us to serve more children and youth in Clark County who cannot access mental health care due to being underinsured or having no insurance at all. So next slide. Just quickly on the need for these dollars, no, my slides are, sorry, my slides did not catch up to you. In Clark County, what we are seeing in terms of the depression and anxiety and rates of suicidal ideation in youth is quite high. It is, according to the Healthy Youth Survey that most recently came out, about 30% of 10th graders report persistent depression, and about 15% of those have actively considered suicide. And the rates of folks who are struggling with the thoughts of suicidal ideation are even higher when we start aggregating out kids who are in the LGBTQ community, BIPOC youth, youth with disabilities. So families are wanting services for their children and are really struggling to find providers. They can't afford care when they can find it, or they can't find providers who offer really relevant services for children and youth. Without this, oh, sorry, next slide, please. Without this kind of access to care, the ripples are obviously felt across the community. Increased crisis calls, increased emergency visits, hospitalization, youth who are not attending school, etc., and then putting more stress on families. So we believe that our program, with your support, could really make a difference for these youth. Next slide. Briefly about Family Solutions. So we have been providing care. We're in our 25th year of service. We have a history of providing services primarily for youth and families funded through Medicaid, although we've got great experience with managing other contracts in terms of state funds, mental health sales tax funds, and a couple of program-specific contracts. We are ready to go in the communities that are in Clark County. We've got strong partnerships with schools, providers, doctors, etc. So primarily what we do is provide mental health services to children and families, and these dollars would allow us to continue providing those services further. Next slide. In terms of the specifics of these grant dollars, we would be looking at about 2/3 of the dollars to provide on-site therapy at Battleground and Prairie high schools. So we have an existing partnership with the Battleground School District, which during last school year, 24-25, we had a therapist out at Yakult and Amboy schools. The funds that supported that were federal funds, and they have been gone. They were defunded. And so we have continued to provide a therapist at the two high schools, and these funds would directly allow her to serve students that typically would not have access to her. The remaining portion of the dollars would be used for communities for services for other parts of the county. So either services here in our clinic, or in other schools, or in community locations, homes, but for students who are outside of Battleground and Prairie high schools. About 15% of our kids currently live in non-Vancouver zip codes around the county. So we know the kids are there, and that would just allow us to increase our access for them. Next slide. In terms of the types of care that we offer really specialized treatment for children and youth, including play therapy, art therapy, some programs that are really designated for kids that are quite young, as well as programs that are for teens. We've got a strong team of clinical providers and strong retention strategies. Next slide. In terms of being able to report back data, we have got a track record of being able to measure what it is that we do and can provide any of those things that you need for that. Next slide, and I'm going to get it in really quick. Just in conclusion, what I would say is thanks for the time for us to be able to be here and present, and Lisa and I can answer any questions.
There any questions? Okay, great. Thank you very much.
Thank you.
Thank you.
Sorry, my phone was acting up, right? Is she still there for questions? I just have
Yes.
one.
Yeah.
Okay, thank you. So you go to the high schools and you've been known to go out a little further. Do you, and it's for, I saw mental health and behavioral health, is that correct?
Yes.
Okay. Because I know that we've got Levy up here, and so I'm hopefully everything goes well, but if it doesn't, this funding could really help the schools. Yes, and to help with these gap services that they may be experiencing.
So,
Is that accurate?
yeah, I mean, we provide the services for folks that really have needs that go beyond what a school counselor might be able to offer. So we, yes and no, if that.
Yeah. So, because I used to help out in the schools, I was a teacher aide for the behavioral health classrooms. Is that something that you help aid with as well?
We see those kids for services and we partner with treatment teams. So one of the things we can offer for some of our youth is care coordination, where we would bring together classroom staff, families, other people who have an investment in a child's life, including our mental health team, and be able to provide services wherever they're needed. So sometimes our youth are seen in a classroom, and other times it might be the need is somewhere else. We are not directly staffing in a classroom.
Okay, and I don't know why. Again, one coffee cup in, so I haven't had my second one, and so the name, the word is escaping me when you do these sit downs with the student and staff and teachers and parents, and they try to work out a plan. What's the name of that plan? You know what I'm referring to? Do you guys sit down when working with the students and staffs to give them resources they need because of the needs that they have for behavioral and mental health? They start. It's not an IUP. IEP?
IEP,
Yeah.
an individualized education plan.
Yeah. Do you guys help with that one?
So
you
if
at the table?
we do not, that's a school plan that is in place. If kids are needing mental health support to meet those IEP goals, absolutely. And we do attend those meetings to talk about children's mental health needs if we're invited to.
Okay, so then would it be correct to say that you guys get to come in once the child has an IEP, or do students not necessarily need an IEP to receive your services?
They do not need an IEP to receive our services.
Okay, thank you.
Yeah, thank you. Sorry if that took a while for us to get to.
No, I appreciate your time. Thank you.
Of course.
Okay, Rebecca, let's move on.
Hi, my name is Becky Zorn, and I am with Lutheran Community Services Northwest. You want to go to the next slide? So I am the Director of Refugee Resettlement and Community Integration, and I'm also joined on this call by my colleagues Josh Stanek from our Advancement Department and Flor Rowe, who is a Program Manager. And so I'm here to talk about our parenting and tutoring support services project that we've proposed. Next slide. So we have requested $75,000. The main activities would be parenting courses along with tutoring services for children ages 8 to 12. We would be serving low-income community, but not only refugees and immigrants, although that is the primary population that we work with in Clark County. And any county resident would be eligible for these services. Next slide, please. So here you can see some of the issues that we plan to address with this grant. I want to say that for the last several years, we've been doing this type of work, and our focus is not only looking at the educational or the academic side of student success, which we do, and we work, we have individuals who have their TFL licenses, so they're certified English teachers. But we also look at the social and emotional welfare of children because there is such a large behavioral health crisis with children in the county. And then with adults, especially refugee and immigrant parents, we've come to realize that they want to support their children, particularly in academic success, but they don't know how to because they don't know a lot about the way that the systems work in the county. And so we highly focus on that. Next slide. So we currently do run tutoring sessions. They are twice weekly, and through this grant, we would have 3 cohorts of children. So we would have 2 that fall in line with the school semesters, as well as 1 that would be conducted over the summer. And those cohorts would also match the parenting courses. And we envision that at minimum 25 families would be served with this grant. So around 7 to 10 families per cohort. Next slide. This work is not new for us. We've implemented similar grants under in both Clark County as well as in the city of Portland. So in the city of Portland, we are funded by the Child Abuse Prevention stream of funding in the Portland Children's Levy. And then we're also funded by Schools Out Washington, where we have tutoring services for refugee and immigrant children. So we already have the curriculum, we have the space, and we have the trained staff who have been doing this work. Next slide. Through this work, we envision that 80% of students would demonstrate improvements in at least one academic or social emotional indicator, and that 80% of parents would report improvement in positive parenting practices and an increase in family stability. And we measure that by conducting client satisfaction surveys twice a year. We have enumerators call the family, speak to them in their language, and ask them a bunch of questions. And so we test both the quality of the work that we're doing, and we also test to ensure that we're meeting our outcomes. Next slide. In terms of compliance, I just want to mention that, of course, we are well placed to follow any contract guidance, and we currently implement over 30 grants under our team with foundation, state, and local funding. And last year, we did pass monitoring missions from both Schools Out Washington and the Portland Children's Levy. So we're confident in our ability to start the program as fast as the funding is received and to implement according to the indicators. And I'm available to take any questions you might have.
Questions from the board?
Sounds like we don't have any for that one. So we'll continue on to the next one then.
Yes, and Becky will continue with their next application.
Yeah, great, thanks. So continuing on again, same introduction, and I'm here to speak about a second proposal that we have, which is for health systems navigation and education. Next slide. So for this, again, we've requested $75,000, and our main activities, I think that text got deleted. So our main activities would be health systems navigation. That can either be a one-off interaction with a client or kind of a long-term support for navigation, as well as a three-part health systems navigation training for our clients. Again, we would be serving low-income individuals in Clark County. And again, while we work with primarily refugees and immigrants, we would not exclusively work with those individuals, and any county resident would be eligible to participate. Next slide. So many of you likely know that changes from HR 1 or the Big Beautiful Bill have been directed primarily at the immigrant and refugee community, including that most of them will lose their medical coverage in the calendar year 2026. This is a huge source of stress for the refugee and immigrant community, as well as the larger community, because people who were once familiar with the health system that they were using know that changes are coming and they don't know how to navigate those changes. So this type of service we recognize is extremely important for families to help reduce their stress levels and kind of support them as the changes come. And we've noticed that health systems navigation is important even for our families who are self-sufficient, because again, the system that they previously used may not be there anymore. Next slide. In terms of the activities, as I mentioned before, we would provide through our medical case managers health systems navigation services. This could be a one-off interaction supporting clients, or it could be a support over a longer duration of time. And we also envision that we would do health systems navigation in a three-part series. The first part would be an introduction to the US healthcare system. The second would be how to use medical apps and portals, especially because many of our clients struggle with digital literacy. And the third would be how to schedule and manage appointments. Next slide. So we have a lot of experience providing this support through two other grants. The first is through the Southwest Washington Accountable Community of Health, where we implement a grant and served 121 clients in Clark County last year. And the other is through the Oregon Health Authority, where we help Oregonians get onto the Oregon Health Plan, and we support them with health systems navigation. And last year we had 445 encounters of health systems navigation in the Portland metro area. Next slide, please. Through this grant, we would endeavor that 75% of clients enrolled in our services report an increased ability to navigate healthcare systems in Clark County. And so we really want to try to push sustainability through this and through most of the grants that we do, especially when we interface with the immigrant and refugee community. The goal of our grants is that, they don't need the support of us and our case managers anymore, and that they can be self-sufficient and manage things themselves. And like the previous grant, we would be measuring this through our client satisfaction surveys, which happen twice a year in April and October. Next slide. The last piece that I want to mention again is that while our primary focus is the immigrant and refugee community, we want to ensure that this grant is not exclusive of that community, and that we're doing our due diligence and our outreach to any individual who needs support with health systems navigation. Again, we know that because of these Medicare changes coming down the pipeline, it's going to be a need for so many individuals, and we want to be as available to the community as we can be. And that's time. So again, happy to take any questions you may have.
I have one question. Herrera, from Battleground City Council. I was wondering what is the outreach that you guys use currently right now to get out to the community?
Yeah, we have a lot of different ways of reaching the community. We work through the library system. We work through a lot of community organizations, churches, and kind of other facets like that. We work through the school system. So we have an MOU with the Evergreen School District. We also work with Clark Community College. So that's kind of the main way that we do outreach. But we're always looking to kind of expand the ways in which we do outreach, especially when we find that there's a new community that we're finding particularly vulnerable. So, you know, in this case, if we found that there was a specific group that was in need of health systems navigation services, we would certainly go to them, to that community, and try to engage them.
Thank you.
Mhm.
Great. Thank you very much. And we will move forward, I'm assuming, Rebecca, based on the schedule here, to Evergreen Habitat for Humanity.
That is correct.
Great.
Hello, good morning, everybody. My name is Bethany. My pronouns are she, they. I am the Grants and Development Coordinator with Evergreen Habitat. And today I'm joined on this call by Leanna Fabian, our Director of Grants and Resource Development. So I'll be talking to you a little bit about our affordability subsidy application for the Lalonde West subdivision. Let's go ahead and go to the next slide, please. So I won't focus on the background of our organization too much. Most of you probably are aware of Evergreen Habitat, but for a really high-level overview, Evergreen Habitat has been around and providing affordable homeownership opportunities in Clark County since 1991. And this year we are celebrating our 35th anniversary. Our vision is a world where everyone has a decent place to live. Unfortunately, in Clark County, we are seeing that that currently is not the case. About 80% of survey participants for the 2024 Clark County Needs Assessment state that housing is one of the top issues for them, and it's been one of the top issues since at least 2017. Evergreen Habitat for Humanity has seen that buyers under 80% AMI are pre-qualifying for much less than the typical home price for the market. And the developer-built homes in the Lalonde West subdivision that we'll be talking about today would likely sell on the open market for about $410,000 to $430,000, while we are seeing our applicants pre-qualify for about $260,000 to $300,000. We do already have $100,000 per unit through the Housing Trust Fund to go towards 10 of these units. But because we have seen extended difference between the market price and pre-qualified buyers, we've been seeking additional sources of subsidy to stay with the home, make it more affordable for low and middle income buyers. So just to give you a little bit of a brief overview about the Lalonde West subdivision, the subdivision is located in the Greater Vancouver area in the Northeast Hazeldale neighborhood. It's located between I-5 and I-205 highways, and it'll be built by Manor Homes LLC and nestled into a suburban area. It has plenty of easy access to highways. It is conveniently located with a quick drive, but quiet and comfort for all the residents. And it has a quick walking distance to Kate and Clarence Lalonde Park, which it is named after. Next slide, please. So we do have a few open subsidy contracts that have offered us a ton of learning and experience in managing these subsidies, such as the City of Vancouver's Affordable Housing Fund, whose dollars are going towards developer-built homes specifically. We've also been utilizing funds from the Washington State Housing Trust Fund 2023 funding round, and that has been for our rehab partnerships with the Vancouver Housing Authority. And in the 2025 funding round, we secured an additional $1 million in affordability subsidies through the Housing Trust Fund. That's also to be used for the Lalonde subdivision. That's the same $100,000 I mentioned earlier to go towards 10 of these properties. And in the last year, we've sold over 30 homes utilizing this subsidy model. And so far, we've seen really great success with this model. The flexibility that it grants buyers is really unmatched and has allowed lower income buyers to achieve the dream of homeownership. So Evergreen Habitat is already experienced in utilizing this model of subsidizing developer-built homes, and we found it to be really extremely effective, especially because of inflated home interest rates currently. It's harder for developers to find market buyers for their properties, so it's the perfect time for us to be utilizing our partnerships with these developers to help provide affordable housing. And one of the great pieces of our program is that once purchased, these homes become affordable housing for future generations as well. Because the homes are part of our Habitat Home Trust, if the homeowner wanted to someday sell their home, it could only be sold back to another low-income buyer that's even beyond the 30-year mortgage term. Next slide, please. So in short, we are seeking $300,000 from Clark County to provide affordability subsidies to 6 properties in the Lalonde West subdivision. These subsidies would buy down the cost of the home based on the monetary need of the applicant in order to make them more affordable to a wider range of low and middle income applicants. This, in conjunction with the Habitat Home Trust, would mean that a one-time investment in subsidy dollars for these homes leaves a lasting impact of affordable housing for years to come in Clark County. Next slide, please. So that is it for me. Does anybody have any questions for us?
I do have a question, and I've always thought about this and never remembered to ask whenever you've made a presentation, but when you retain ownership, or when Evergreen Habitat maintains ownership of the land, how does that work? Because you're receiving like one-time grant funds for this, but when the land is purchased, you'll have a perpetual or not interest, but taxes that you'll have to pay on the land. And how does your model cover that?
Yeah, Leanna, do you want to take that one?
I'm happy to jump in on that. Yeah, our home buyers do pay property taxes. We have ownership over that land, but we don't have any rights to the use of the land. The owner does of course use that land, but they are qualified for a lower property tax rate because of the assessment of their property takes into consideration the land trust model.
So they pay the property tax on the land?
Mm-hmm, they do, yes.
Okay, interesting. Thank you.
Yeah, you're welcome.
Any other questions from the board? All right, not hearing any. We can thank you for Evergreen. We will move on to our next presenters from Fourth Plane Forward.
Hi, good morning, everybody. Paul Burgess, Exec Director for Fourth Plane Forward here. We're Clark County's first community development corporation serving the Fourth Plane Corridor and micro enterprise owners countywide. And as you can see on Jose's words on the screen, he came to us not knowing this kind of support existed. Most of the entrepreneurs we work with start in the same place. And I want to show you what we've delivered in 2025, the model we built, and what we're proposing for 2027. Next slide, please. So in 2025, our team delivered over 1,000 hours of dedicated technical assistance to micro enterprise owners across the county that covered business formalization, licensing and permitting, financial planning, and addressing language and technology barriers, all bilingual and all hands-on. The outcomes for this, 21 business licenses were approved, well above our contract target of 5. 18 businesses reported increased revenue, and 10 new businesses were created. These results come from sustained one-on-one support that meets the entrepreneurs where they're at. Next slide, please. Behind those numbers is a coaching model built on relationships. We supported 71 businesses through our consistent bilingual engagement. Our approach centers on a relationship-based trust, business mindset development, helping people think like business owners, and guided goal setting with real accountability. 21 of those entrepreneurs received the deepest level of structured support through our IDA and food business programs. And talking of those IDA and food business programs, next slide, please. We deployed $50,400 in direct grants to 14 businesses through 2 pathways. Our IDA program provided $24,000 in match savings to 8 entrepreneurs in a 6-to-1 match. And that funding enabled working capital, it paid for marketing, covered salaries, and helped boost business operations, real investments that kept those businesses moving forward. Our food business incubator awarded $26,400 in grants to 6 family-run businesses. That funding covered food permits and compliance costs. the exact expenses that create barriers for low-income food entrepreneurs. And this was the first Spanish language food business incubator in Clark County, and it launched 6 operating businesses. Next slide, please. So we also fully expended our 2025 allocation of $299,000. 91% of that went directly to program delivery. Staff time with entrepreneurs, instructors, interpreters, grants and IDA match funds, and just 9% covered administrative costs. So every dollar accounted for, 91 cents of every dollar in direct service. Next slide, please. And so we created an ecosystem which didn't appear overnight. We've spent the last several years building it, testing components, adding capacity, listening to what entrepreneurs actually need. What started as a corridor level business support has grown into a county-wide model that Clark County is now funding through CDBG, and it's working. In 2026, this is the system we're operating. The entrepreneur sits at the center, and around them are coordinated entry points. Business Connect workshops, Business Academy cohorts, one-on-one technical assistance, coaching, commissary kitchen, IDA, grant programs, and our lending agency. Each one feeds the other. An entrepreneur who starts in a workshop can move through all of these, strengthen their financial position, access a grant, access a loan, all within the same ecosystem and all available bilingually and designed for the communities we serve across Clark County. Next slide, please. The Business Academy offers 4 to 6 week cohort-based trainings, 4 3-hour coaching sessions per course in food business, construction, health and beauty, and foundational topics as well. We partner with local consultants to deliver these trainings, people doing the work who come from the same communities as our clients. The instructions are bilingual, but also the trainers understand the lived experience of the entrepreneurs sitting in front of them. And that's what helps us build our trust. Next slide, please. We also provide Business Connect workshops and coaching, and these are our monthly low barrier entry point, marketing, bookkeeping, open enrollment, and there's no prerequisites. They're again delivered by consultants and subject matter experts drawn from the communities we serve. And we also provide access to one-on-one coaching, technical assistance, business mindset coaching, licensing support, and we have deep knowledge of childcare and health and beauty and food businesses. Next slide, please. Our IDA and funding pathways, the individual accounts that we're offering offer a 6-to-1 match over a 24-week program. Participants can also access CDBG funded business grants. And what we do is if we don't have access to what the entrepreneur needs, we refer that out as well. We partner with other lenders, workforce agencies, CBOs, Clark College, etc. Next slide, please. So we've been building this program, and sorry, next slide after that. My apologies to stay on this one. So these are our targets. We know that we can serve between 75 to 80 people, and again, following through from 2025 and 2026. Next slide. And the goal here, again, is to spend 91% of our budget on direct program costs, so $280,000 in total. That's it. Thanks.
Thank you. Questions from the board?
I don't have any questions, but I did want to say hi, Paul. It's been a really long time since we bumped into each other. Paul lives in my neighborhood, and we used to see each other all the time, but now it seems like a seldom occurrence. So it's good to see you.
Yeah.
All right, not hearing any questions from the board, we will move on to the next presentation. Thank you so much from Fourth Plane Forward.
Thanks.
Our next is a presentation from Greater Vancouver Chamber of Commerce. Janet? I am not seeing Janet in the meeting yet. We will go ahead and move on to the next presentation. If we have time, we will come back to Greater Vancouver. Thank you. One moment. All right, Hispanic Metropolitan, Nicole?
Good morning, everyone. Can you hear me okay?
Yes.
Okay, perfect. All right. Good morning, everyone. My name is Nicole Davison Leon. I'm the Executive Director here at the Hispanic Metropolitan Chamber. And I am with my colleague, Andrea Forstag, who's the Business Developer Manager as well. We're grateful for Clark County's continued partnership and investment in small business. Next slide. The Hispanic Metropolitan Chamber serves, our focus really is wealth creation throughout Oregon and Southwest Washington. Today's program that I'm here to chat with you all about is our Small Business Development Program. We see that small businesses continue to face significant economic pressures. Over the past year, we've seen a compounding challenges from rising costs to workforce instability to tariff impact and heightened uncertainty driven by immigration enforcement layered on top of long-standing systemic barriers. For many of the businesses we see this last year, they are reporting a revenue reduction that has been up to 60%, delayed in growth, and in some cases, closure. These are micro enterprises that are often family run with fewer than 5 employees, deeply rooted in neighborhood and local economy. When they struggle, the ripple effects are felt across the household, jobs, and community instability. Next slide, please. Next slide. This gap is what HMC is proposing for the micro enterprise program that is designed to address. You can see here some of our numbers from 2025. In 2025, HMC served 50 unique businesses. This is meaning that each of these 50 businesses received one-on-one assistance by one of our business advisors. 57% of those businesses identified as women, and HMC was able to leverage over $1 million in capital leverage. This is in partnership with Workforce Southwest Washington, as well as with the Department of Commerce, meaning that small business were able to receive either grants or loan to grant programs. To your left, you can also see this is sort of the breakdown of some of the businesses that we see from construction, food, janitorial, landscaping, retail, childcare, and other services. So HMC services are really a holistic approach, and we see businesses in all variety of industry. Next slide. What exactly does HMC do? HMC delivers responsive economic technical assistance to low and moderate income business owners located in Clark County. Here are some of the services that HMC offers to their businesses at free of cost, from business startup to expansion to licensing and permit to business planning and marketing, financial education, review operation management systems, and asset protection. HMC works to individualize the programs versus a one-time model. We really do work with the business to understand the different needs of it. One example with today's current environment has been businesses have had to reimagine what their business is, such as our food industry, knowing that they have received a lot of reduction in sales. Our business advisors are working with businesses to implement food delivery options, online options, catering options, and so much more. Next slide. Here's just a little background of Clark County. The Hispanic Metropolitan Chamber has been working with Clark County since 2019. We provide bilingual bicultural business services. We have an office located in the Vancouver area, and we have longstanding community relationships throughout Clark County and Southwest Washington. Next slide. Oh, before I get to our, I have 50 seconds. Before we get to our client success story, one of the things that these relationships that we've been able to build, such as with one of our business owners here, Maria Veronica Asensio, who we were able to help open their Club Carousel bilingual daycare, which we know it's much needed, specifically in Clark County. These businesses, not only was she receiving a one-on-one assistance, but she was able to join our Financial Literacy Summit, where we had over 150 entrepreneurs, combined with over 50 different experts from the financial institution to legal services and so much more. HMC program, I'll just do a small closing, but in closing, the Clark County investment through CDBG is not just supporting individual business, it is stabilizing families, protecting jobs, and strengthening the local economic crucial moment that we're currently living, and HMC is looking forward to continuing to work with Clark County to support our small business out there.
Thank you, Nicole. Any questions from the board?
I do have one question. And I'm curious, when you work with businesses, especially with if they're looking into expansion, and maybe I missed this from the beginning of the presentation, but do you have any like income requirements or restrictions before you'll work with folks?
So we do have, we follow the HUD requirements for all of our businesses that we see. So they all go through HUD income verification, meaning they have to be low to moderate income households. If for expansion, anyone outside of that, we would serve them through a different contract through the Department of Commerce. So through this CDBG contract, all entrepreneurs will be served with that income eligibility.
Okay, great, thank you.
Mm-hmm.
Any other questions from the board? All right, we have Janet with the Greater Vancouver Chamber, so we will go ahead and go back to that presentation. One moment. All right, Janet, you have 5 minutes.
Hi, good morning. Can you hear me?
We can.
Fantastic. And then I'll just ask you for forwarding the slides. This particular program from the Greater Vancouver Chamber is on our, what we call our business pod, our technical assistance program. Next slide. Our mission at the Chamber is to support business, make sure that we have inclusive and opportunities for businesses to thrive. We advocate and help support the broader business community. Next slide. Our team, I can move past this. That's the Chamber team that helps support our mission. And then this particular program is the technical assistance for the small businesses in Clark County. Looking at, I put our main reason here, 8 out of 10 small businesses report they cannot access capital in order to grow. This is where we focus a lot of our technical assistance and our support in order to help that growth stage of businesses. And then also focusing on those that come to us in the idea and pre-revenue phase to support the foundation of building a business here in Southwest Washington. So breaking down those barriers and helping the businesses really understand the gap in technical assistance that they have, which oftentimes is different from what they come to us with. Many times they come to us with a marketing need, and then through an intake process and some one-on-one, identifying that really they do need more technical assistance on the financial or the formation pieces of the organization. Next slide. We have several different ways that we layer on support for the small businesses. We have a very successful cohort package that we run people through, putting them in like sectors or industries or those that might have some correlation. We have workshop participation. We do have open houses so they can meet each other and start building those connections in the community. We also offer opportunities for them to provide testimonials, not just on their business, but also to help other micro enterprises understand that they're not in this on their own. And then we spend quite a bit of time on loan ready referrals back to our financial community or other areas where they can receive financial support for the growth of their business. So it's not necessarily tied to banks and credit unions, which is pretty typical. Next slide. This is a pathway of how it might work. We do intakes and assessment. We also have coaching and guidance, skill development, cohort experience, launch and pathways, and a lot of these can work interdependently or they can work together. So each one is customized for the particular entrepreneur or small business that's coming to the Chamber for assistance. Next slide. Reports, what we've had in the past year, I wanted to make sure that understood some of the stages of business that were coming to us. This is what came to us last year, where you can see quite a few people in the idea creation phase and the pre-revenue phase. Only a couple of them coming to us in the mature phase, and that's really for a growth or being able to take a step back and identifying truly what's holding them back. Pretty diverse race mix up and as well as gender. Next slide. We have 10 different zip codes throughout Clark County that's being assisted. So we have applications that come through throughout Clark County, everywhere from Ridgefield, Camas, Washougal, Woodland, Yacolt. It's quite a bit of mix, and we work with companies all throughout Clark County. And of course, this is not including Vancouver. Next slide. One of the things that we work with, and this is a pretty typical company that would come to us, that they're mixing personal and business finances. And even though this company was actually on a really great growth stage, they were in fear of closing in the next year because they did not have their financials. And then added on top of that, a lot of the regulatory environment that Washington State has introduced in the last couple of years, making it really difficult for small businesses to discern what taxes, how they pay, who's impacted, how they can calculate. That's where we're spending a considerable amount of our time in the last year, which is a little different than we've dealt with in the past. So really helping a company build a cash flow plan that makes them stable, which is a pretty typical scenario for a company. Next slide. Testimonials, next slide. I have the ask here, next slide. Sorry, some testimonials. This is our request for CDBG application request. So 75,000, we're estimating 75 to 100 companies, now understanding some of the barriers that are hitting our companies in 25 and 2026. So
thank you very much. Are there any questions from the board?
Yeah, and I have a similar question as I had for the Hispanic Chamber, but maybe expand a little bit more on about it. And I'm just curious, as I'm looking at these presentations, and I'm seeing a lot about business expansion, and I'm kind of struggling to kind of see the, generally speaking, when businesses are thinking of expansion, starting a business is, I totally get it. I mean, that is it's a very difficult thing to do, very straining. There's a lot to learn, and the services that you provide for that are phenomenal in helping businesses get established. But generally speaking, I mean, my assumption is, and I don't have as much knowledge as you, of course, but my thought is that businesses typically don't expand or consider expansion until they're doing well financially. So I'm trying to find that nexus here, and maybe you can expand on that a little bit.
Yeah, that's a good question. I think it comes down to, what does the business consider expanding? So for us, expanding, it could be expanding their reach to capital. It could be expanding. It could be adding one staff person. It could be adding a part-time business owner who also has a different job, expanding that to full-time. So yeah, it doesn't mean expanding a number of locations, but also it could mean expanding their SKUs, expanding their offerings, something to get them from where they are foundationally to that next step. And you're right, it's very different for every customer. And most of the time we're working on those foundational changes that can help the expansion. So with that customer there that gave the example, that's very typical, decoupling those finances, decoupling and showing how they can account for that on a bookkeeping and also taxes really helps them understand how they can expand. A lot of them are stuck in that phase where they cannot grow. Sales is included in that growth. They're stuck there, and yeah, it's causing a lot of our business community to either stick their heads in the sand or not move forward.
Great, thank you. I think that helps a lot. I think the definition of expansion was fairly narrow in my
agreed
my vocabulary there.
No, I agree.
Thank you.
Yeah.
Questions from any other board members? Not hearing any, we will move on to our next presenter.
Thank you.
With MISO, the Micro Enterprises. Sorry, it is with Proud Ground. No, we should be with MISO. Hold on just one moment. Technical difficulties. Okay, there we go. I apologize. Micro Enterprises Services of Oregon. Jatan, are you available?
I am. Good morning, everyone. My name is Jatan Hall. I am the Programs Director here at Micro Enterprise Services of Oregon, also known as MISO. Next slide. And one of the things that we do a lot, especially in the Portland, Vancouver, Gresham, and Beaverton markets, is elevating entrepreneurs. And what that looks like for us is truly helping them with technical assistance, helping them understand themselves as a business, as well as accessing the capital. We are a CDFI, and so we're able to do loans up to $250,000, depending on what they're looking to do. We also are not in the business to get somebody into a loan that they're not able to repay. So we take a lot of time, energy, and effort in understanding their financial side of things and helping them to grow and understand how to increase their business as well. We do a lot with marketing and branding, market research. We offer a lot of classes and workshops. Most of those are virtual right now, so it makes it easy for anyone to attend. And then we also can offer it where they can come back and watch it at a later time. We do networking events throughout all of our areas that we serve, especially in the Vancouver market. And then we personalize, develop opportunities for the businesses that we serve throughout our organization. Next slide. For us, going back into business advising and technical assistance, we focus on strategic planning and collaboration with each business owner, creating a healthy relationship where support services can be offered in an integrated manner. We really customize to meet the client's needs, where they currently are and how they look to grow within their businesses. Each entrepreneur is assigned a business advisor and receives tailored one-on-one support with that. And then listed there are some of the things that we support as far as tailored services, from financial management, time management, budgeting, forecasting, credit enhancement, personal development, confidence building, business strategies, implementation, planning, goal setting, you name it, we do it. Next slide. This helps us break it down a little bit more in our customized services. And so each business develops and grows in its own unique way. We provide client-centric support and resources. We develop methods, our delivery methods, are both dynamic and customized. And by limiting our caseloads, we have greater access, involvement, and interactions with the clients that we serve. And here's kind of like the pathway that we take with that. We start by listening and assessing. We take action. We review, and if something's not working or need adjustments, we do make those adjustments and we continue on within that cycle. Next slide. Our ask here from Clark County Funding is for us to be able to provide technical assistance to empower low, moderate to income entrepreneurs to start and grow micro enterprise businesses. We're looking to work with about 20 micro enterprise entrepreneurs for their business who are low to moderate income from vulnerable populations. And then MISO will limit support to Clark County clients, not working with those within the city of Vancouver because we have additional funding to do that work already. MISO will focus on providing one-on-one customized technical assistance, including business education, and serve both clients seeking short-term services and supports as well as seeking long-term services and support. Next slide. Our goal to make this happen is our outreach, of course, and that will be conducting outreach throughout the city of Vancouver, outside the city limits of Vancouver, holding community outreach networking events in micro enterprise and micro businesses. I love this opportunity because myself and our business advisor who serves the Vancouver market, we both live in the city of, or we live in Vancouver. I'm technically outside the city limits myself. And so being able to network and partner and be present in the community makes a difference and an impact. Of course, providing ongoing access to in-person and virtual classes and workshops through MISO's business education program. And MISO already has an established presence and office here in Vancouver in Banner Bank. And then MISO also has, we offer a full range of services and programs, many in both English and Spanish. Next slide. And really quick, just want to elaborate on a client spotlight that we have here. We have Rosa Garcia, who launched Rosa's Natural Products, LLC, in 2020 in Vancouver, Washington. She became a MISO client in April 2021 and quickly embraced the resources and support MISO offers to grow her business. With guidance from her MISO business advisor in Vancouver, Rosa gained essential knowledge about Washington state rules and regulations for selling body care products. This enabled her to rebrand, relabel, and repackage her products in compliance with state regulations. MISO also supported her with business licensing, registration, documentation, pricing, expense management, POS selection, and preparation for financial statements, providing a strong foundation for growth. Rosa is a shining example of how taking the right steps can lead to small business success. Since launching her business, she has expanded her online presence by selling on Amazon, Faire, and her updated website, invested in professional photography, label design, website enhancements, barcodes, social media content, and advertising campaigns. She also established retail partnerships, including Oryx and the Portland Airport and Jardin de la Rosas, while operating as a home-based business. So we're excited for that. Next slide, and we'll just leave it there and open it for questions.
Thank you, Jatan. Any questions from the board?
I do have one question. And I apologize. I know that you have, I mean, we've seen multiple applications from you folks in the past, and but I was curious. I noticed, you know, you at some point you expanded into Clark County. Do you have a location here in Vancouver?
Yes, we do. We're currently operating out of Banner Bank off of 164th.
Okay, great. That's good to know. Thank you.
Absolutely.
Any other questions? All right, not hearing any. Thank you, Jatan. And we will move on to our next presentation. Katie with Proud Ground.
Good morning, everybody. My name's Katie Ulrich, and I am the Associate Director at Proud Ground. Proud Ground is a community land trust, and we help first-time home buyers basically purchase homes at affordable prices, and we ensure those homes stay affordable for other income qualified households into the future. Next slide, please. For those that aren't familiar with the community land trust model, this model of homeownership is intended to secure permanent affordability. So our home buyers actually purchase the house, and Proud Ground purchases the land under the home, and that legal agreement between our nonprofit and the home buyer ensures that if or when they sell that home in the future, it will be sold at an affordable price to another lower moderate income household. So thus ensuring that these homes stay permanently affordable. Next slide. And we have been working and doing this program in Clark County with the support of the county since 2014. Since then, we have helped 31 homeowners purchase homes. 71% of those households are from communities that are underrepresented in home ownership. A majority of them are households with children with an average median income of 64%. Next slide, please. This year's request is for $250,000. We can utilize either CDBG funds or home funds for our program. This request would support 3 new home buyers in purchasing a home within Clark County outside of the city of Vancouver. This scenario shows a home buyer purchasing a home that's about $420,000, $73,333 on average per home buyer would be used of the Clark County funds. We would then leverage that funding with additional public investment and support, and the home buyer themselves actually secures a mortgage or a first loan to purchase the property as well. All of this at a program delivery cost estimated at about $6,000 per home buyer. And then these homes, as I mentioned before, become permanently affordable. And so in the future, as they resell to additional lower moderate income households, no additional funding is needed to create and support that next homeowner in the future. I did put an asterisk. Our leveraged public investment in our application was intended to come from the Washington Housing Trust Fund. We unfortunately were not awarded funds in this last round, but we do think that we do have ongoing support from a federal program called the SHOP program, and we'll look into other matching funds as well to make this, this work. Next slide, please. And as you know, I mean, homeownership has become increasingly unaffordable in Clark County. The market rate home is about $550,000, whereas the median sales prices of the homeowners that have purchased homes through our program in the last 2 years has been closer to $250,000. So this really does open up homeownership for a group of community members that would not otherwise be able to experience that stability. These are examples of some homeowners that have purchased are in the past in Clark County. I did want to highlight one of our households that purchased last year. This is not a picture of them on the side, but it was a single mother with 4 children, earned about 71% of the area median income, and she was able to purchase a $400,000 home for only $250,000 through our program. And she ended up with a house payment that was very similar to what she was paying in rent. So she's very excited to get the stability and security for her kiddos in home ownership. Next slide, please. And then this is just, you know, we have had homes resell through our program in Clark County over the years. We've had 2. And those have, this is just a lot of numbers, but it kind of shows how the program works and how we're able to retain that affordability at resale to the next home buyer. So we were actually able to serve 2 more households through this program without any additional subsidy or grant requests needed. And those households that sold, you know, sold for the same reasons as most of market rate sellers, as far as job relocation or other things that they plan to do, and a majority of them do go on to purchase a market rate home. So that is, I think the next slide is just my question slide. So I'll just open it up for questions.
Thank you, Katie. Any questions from the board?
I just wanted to clarify from that last slide. So the equity that's built in the home stays with the owner, right? So when they sell, they benefit from that?
Yeah, they do. So our homeowners receive what they paid for the home when they purchased it. So in the example, it was, you know, about 250,000 or something from my slide. They also then get at resale, they get 25% of any change in market value.
They get, okay.
Yeah, and then they also, of course, as a homeowner, you know, rather than paying rent, that's paying their landlord's balance down on their mortgage, those payments are lowering the principal on their home loan as well. So they get essentially 100% of what they've paid down on their mortgage, plus 25% of the increase in value.
And then how does the other 75% work then? I mean, that works towards keeping the sale price lower, or?
Right. Yeah, so on this slide, you know, these homes, the second line there says resale home market value. So the market value at resale for the first example was 270,000, but the house on top of Proud Grounds land sold to another low-income homeowner for 181,250. So those numbers exist on paper, but it essentially stays in the property and becomes the down payment or subsidy for the next home buyer.
Okay, and I'm sorry to drill you on this, but I'm just
that's
generating a lot of questions for me. So a couple things. One is if they're only able to take 25% of that growth, then how does that you know, set the stage for them? Like, let's say, I mean, it's one thing if they're like upgrading to a larger home or something like that, but if they're just needing to relocate because their job relocates, when they are only able to take 25% of that equity, how do they stay in line and be able to purchase wherever it is that they're going to move to?
Yeah, so they do, you know, these homeowners, like I said, over about 60 to 65% of homeowners in community land trusts, and this is actually nationally, but we're also seeing it as well, do go on to purchase a market rate home with the equity that they've earned in homeownership with the homeownership from the community land trust. So it does become a stepping stone to homeownership. A lot of our families come and purchase this home without much of their own down payment, but by again having the community land trust home, it becomes a way for them to have that savings for the next home. With that said, many of our homeowners are looking at this as a long-term purchase. They are really wanting to stay in the community. They're really wanting to set down roots. They're actually asking more about inheritance and how that works, which it is possible to leave these homes to their heirs as well.
And you said that only 2 of the homes have resold. Was that, did I hear that correctly?
That's right. Yeah, I think that in Clark County, I looked at only 2 have sold since 2014. So we are seeing that people are using this as a way to stay put in the community.
Yeah, that stability I think is incredibly important for folks. So thank you for that. The next question I had was back to the 75,000 the housing trust funds that we have not been getting a whole lot of here in Clark County recently. But what does that look like? I mean, if it sounds like you don't have a specific identified replacement for that, but you're kind of anticipating hopefully that you will, and what would it mean for the program if you're unable to secure that?
Yeah, great question. So the SHOP funds that we definitely have allocations of that would be matched is 25,000. So we would, easily replace 25,000 with that. We also, I think in my scenario, the homebuyer's mortgage was about 275,000, which is what we try to go for. But we may need to have our homeowners contribute a little bit more if that's possible. And then we may need to look at other more affordable homes as well.
Okay, and then just adding on to that, so when you say that you may need your buyers to contribute a little bit more, does that mean essentially that you're going to have to be serving folks with a little bit higher AMI?
Potentially, yes. That's
Okay. Okay. All right. Thank you.
This is Rebecca with staff. I will also add to the resale, there's a specific HUD resale and recapture formula that our programs have to use. It's been approved by them. So Proud Ground is not setting that 25% gets returned to the home. That's actually a HUD home program requirement for what that resale and recapture formula looks like. So both Evergreen Habitat and Proud Ground and any other home down payment assistance programs would all follow that same model for any resale of purchases made through this original application.
Good to know. Thank you, Rebecca.
Any other questions from the board? All right, we will go ahead and move on to our next presentation from Support for Early Learning and Families. Debbie, are you available?
I am. Can you hear me?
We can. Thank you.
Thank you. I appreciate so much the opportunity to be able to share with you today about the project that we've been working on for a few years to increase access to quality, affordable childcare. We've mostly been working in the city of Vancouver, and we now are working in Cowlitz County and hoping to expand throughout all of Clark County with this proposal. I'm sure it's not of any surprise to anyone here that childcare and access to childcare has been problematic for quite some time, and specifically family childcare, which means that the provider's home is licensed by the state of Washington and their business operates out of their home. And there are a lot of requirements that come with that, but it's a smaller environment, and it's certainly an important part of the overall mix of childcare programs available to working families. So that our focus is on family childcare specifically. So we during COVID, we really saw a huge drop even more than what had previously been occurring in the access to neighborhood family child care providers. And as we started coming out of COVID, we really thought that we could maybe work in neighborhoods and in the community to make change that a little bit. So if you would go to the next slide, please. So what we embarked on was just doing outreach and recruitment throughout the city of Vancouver, seeking individuals who wanted to own their own business and really loved working with kids. Those are 2 criteria. So since then, we have actually assisted 15 providers in opening a licensed family child care home. As you will see on here, it says 12 of the 15 are serving families who are on Working Connections child care. So we're reaching some of the families who have lower incomes and need that additional support. And then also we've added currently, right as of today, we have 113 new licensed childcare slots that have been established in the community. And I don't know if you're aware about the complexities of becoming a licensed family childcare provider, but it's significant. Or opening a center for that matter. It's a significant cost, and there are a lot of work that needs to be done in order to secure that license. And that's the support that we're providing them. Would you go to the next slide, please? I wanted to give you just a real life example of an individual who a few years ago opened her licensed family child care home. Her name is Lucero. She, you can see all of the information about her on this slide, but I think the important thing really to understand is that over time she has grown her business, grown herself, and she just recently was awarded in the state of Washington, the quality rating and improvement system for childcare is called Early Achievers, and she was awarded a level 4 Achievers Award, and she is making her the only bilingual provider in Southwest Washington to achieve that level, and 5 is the highest level you can go. So she's just one example of the amazing people that we're working with within this cohort. Would you go to the next slide, please? So I'm happy to answer any questions, but I wanted to also just share with you the impact that the funding that you would give us we are projecting would occur. So the number of homes that we would be able to license, the outreach and recruitment we would be able to offer. And in addition to licensing, we provide a lot of just how do you market your business, what do taxes look like? I mean, there are a myriad of details that are involved in helping support these providers becoming licensed. I guess in the end, also, I would just like to say that childcare is there are small businesses. They help working families, but they also help our local economy so businesses can have a stable workforce. And so that was the kind of the impetus behind the reason that we wanted to do this project, and have found that it's been very successful, and hope to have the opportunity to expand it. Sorry, I'm really nervous. I'm sorry. Anyway, I think that's all I really have to say. Thank you, and I'm happy to answer any questions you have.
Thank you. Questions from the board?
I would just say thank you for your presentation. No need to be nervous. You did a great job.
Thank you. We appreciate the opportunity.
All right, not hearing any other questions. Thank you so much, Debbie. We'll move on to our next presentation with Upwards Care. Melanie, are you ready?
Yes, I'm ready. Thank you.
All right, thank you. You have 5 minutes.
Thank you. Good morning. My name is Melanie Four. I'm the Community Impact Manager at Upwards. I want to thank you for the opportunity to share how our Boost program can support Clark County's family child care providers and working families. Next slide, please. Boost is, you can jump ahead a couple slides. Yeah, that's good. Thank you. Boost is a year-long one-on-one mentorship program that empowers low to moderate income family child care providers with personalized coaching, business training, and digital tools. Actually, you can jump ahead to slide 6, please. Thanks. Debbie did a great job recapping the need, so I'll try to focus on what differentiates Boost. So providers receive free access to our child care management system, plus hands-on coaching from bilingual care specialists. We help them stabilize income, expand their enrollment, which helps increase revenue, and hire teaching assistants. We're requesting $104,000 in CDBG funds to support 13 low to moderate income micro enterprise daycare owners. So unlike, I guess we're kind of picking up after they've already been licensed. And with that, we'll help them create 4 new teaching assistant jobs and serve over 150 families in Clark County. So there is a family component that's significant, although for CDBG purposes, we'll focus on the direct beneficiaries, which would be the micro enterprise business owners. So right off the bat, the providers will receive a custom business action plan, custom marketing materials, so that's a dedicated web listing, and more. Throughout the year, the providers receive consistent one-on-one mentorship to tackle their specific business goals. Next slide, please. And by year's end, 30% of providers will increase revenue and again, create those 3 new teaching positions to expand childcare slots. Again, Debbie did a great job of recapping the need, but just for reference, providers in the county earn on average 20% an hour. Statewide, they're in the bottom 3% of wage earners. So clearly low wages makes it hard for them to stay in business. And as Debbie mentioned, many facilities have closed in the last few years. So really what, Boost believes is that one-time funding isn't enough. They need, providers need ongoing support and business skills to thrive. So part of that sustainability is the continued free access to our child care management system, which helps with everything. It basically helps streamline all the administrative side of running an in-home daycare. This is something we've been developing since 2017 and constantly iterating and improving to reflect the feedback we get from providers. And again, I also want to highlight that the families in the county would get access to a dedicated care specialist who can help them find backup care in as short as 24 hours. So the good news is Boost is a proven program. Upwards has successfully implemented Boost in over 30 cities and counties nationwide. We're in year 2 at Bellevue, just launched in Everett, about to launch in Bremerton and then Federal Way later this summer. Our projected outcomes in the application are conservative, but we have continued to exceed those projected outcomes. So just for reference, in 2024, we partnered with 12 cities to support 220 providers and assisted them in creating 129 new jobs. And in the last minute, I just want to share a testimonial that really highlights what makes the Boost program special. This is from Celeste Watcher. And yes, you can go ahead to the next slide. Thank you. So Celeste in Bellevue says, "Thank you for all your support. You're like a ray of sunshine in a world that can be very lonely at times. In 15 years of running my own program, I have never had someone in my corner constantly ready to help and checking in to remind me that I'm not alone in this business. There are truly people who care. Thank you from the bottom of my heart. You're amazing and make a difference every single day." So by investing in Boost, you're ensuring that these critical small businesses thrive. Parents like myself can get back to work and families benefit from expanded access to affordable, high quality care. And I want to put an emphasis on the quality. Before joining Upwards 2 years ago, I was a client for 2 years. Both my boys went to Upwards Partner Daycares, and it was the quality. It was the quality with the affordability that really was validating and made me want to join the team. So with that, I'll open it up to any questions. Thank you.
Thank you. Any questions from the board? And I usually spend a lot more time focusing on the needs, but wanted to respond to the, to Debbie's presentation. So hopefully I could address how we would complement self. All right, not hearing any questions from the board, we will move on to our 10-minute break. And then we will move into our affordable housing and homelessness application presentations. All right, welcome back, board members and presenters. We are ready to move on to our next presentation from Columbia Nonprofit Housing for their project River and Main. Grace, are you available?
I am. Are you able to hear me?
We can. Thank you very much. You have 5
Excellent.
minutes.
Okay, thank you. Okay. So my name is Grace Dudley. I'll be presenting the River and Main project today on behalf of Columbia Nonprofit Housing. For those who were on the board last year, this may be familiar to you. I will talk through the project with some updates later in the presentation, describing why we are returning for funding. Next slide, please. So River and Main is a new construction project located in Washougal. It will serve low-income seniors. The property is projected to be 40 units that are restricted for seniors age 62 and older. Half of the units will serve households at 30% area median income, and half of the units will serve households earning at 50% of the area median income. Next slide, please. River and Main will address a high level of need for senior housing in Clark County, in particular a documented need for senior housing outside of Vancouver. Our plan with this project is that it will expand housing opportunities for seniors in Clark County and provide housing that is specifically designed to meet the needs of seniors. Additionally, the project will leverage new public and private investment in the area and help to alleviate some of the pressures that low-income seniors in the area may see as a result of these new investments. Next slide, please. River and Main is located in downtown Washougal. It's just a few blocks away from the library, the senior center, the new public parks, as well as the Lewis and Clark Heritage Trail. In addition, the property has easy access to grocery stores, to banks, pharmacies, transit. So it's really a space that is beneficial to seniors who would be living in the area. The building is designed with elements of universal design to promote aging in place. And this includes accessible features in the units as well as in the larger building, and a focus on community with lots of shared spaces designed to foster community among residents, with gathering spaces both indoors and outdoors. The project will also have an on-site service coordinator who will facilitate building-wide events and work with residents one-on-one to connect them with other resources locally and with state and federal programs to support their needs outside of housing. Next slide, please. So since the last presentation, there have been changes in funding availability that have shifted our project budget and timeline a little bit. So last year we were awarded $300,000 in home funds, and the project was originally planned to utilize HUD Section 202 funding, both on the capital side and on the operational side. Unfortunately, that program is not currently funding new projects, and it's not projected to fund new projects over the next few years. Luckily, there have been updates to the low-income housing tax credit policy that have increased our access to equity, and the project has also seen some cost savings on the construction side and the soft cost side that have lessened the impact of the gap due to the unavailability of the Section 202 funding. We are requesting an additional $400,000 in home funds to address some of the remaining gap, and currently we're showing sponsor equity and a loan from the Vancouver Housing Authority to fill the remaining gap. On the operations side, we are planning to utilize what is called the Restore Rebuild program through HUD, which is formerly known as the Fair Cloth to Rad program. This subsidy would apply to all units on the project and would allow residents to pay only 30% of their income, with the remaining amount of rent covered through the Restore Rebuild vouchers. Next slide, please. The project timeline, because of the delays of funding, has shifted out 1 year. So we are projecting that all funding will be secured by February 2027, with construction start planned in July 2027 and construction completion in August 2028. And I believe I made it just in time, so I'm happy to answer any questions.
Thank you. Any questions from the board?
Just real quickly, could you remind me how many units there are?
Yes, 40 units.
40?
Yes, correct.
Okay, thank you.
Any other questions? Not hearing any. Thank you, Grace. We will move on to our next presentation. Jacob, for the Foundation for the Challenged, FFC Homes 15.
Good morning. Can everyone hear me okay?
We can. Thank you.
Wonderful. Thank you and the board in Clark County very much for this opportunity to present this much needed project. My name is Jacob Polowitz. I've been one of the lead development consultants for Options for Supported Housing, also known as Foundation for the Challenged, for the past 10 years. Options is a leading affordable housing provider for individuals with intellectual and developmental disabilities nationwide and here in Washington State. In this state, they currently have 60 homes, including one in Clark County, that all have affordability at 30% of AMI, and 95% of those properties also have accessibility components. And so they're looking at just about 200 individuals who are living in these 60 homes. And you'll see on the next slide, when we talk about need, there was a comprehensive study done by DSHS. If you go to the next slide, please. You can see that there's a huge need. We're looking, this was 3 years prior, but we're looking at 50,000 individuals in the state that are estimated to be adults with IDD, and about 80% of that population is facing a housing risk. And if you start to add the affordability components, the accessibility components, the need grows. And while this study is a little over 3 years old, all indications are that the need is growing, and the ability to meet that need is not keeping up, even with great support from local funding and state funding. If you go on to the next slide, you'll see what Options is proposing for this Clark County project. So for a $200,000 Clark County request, Options proposes to develop 2 3-bedroom single-family homes in Clark County. This will be for, again, individuals who are at or below 30% of AMI. Accessibility components will be included. You can see in these photos here kind of the model that Options likes to follow. You can see that there's a roll-in shower bathroom, there's ramping. If we find houses with level entry, that's also great. I think the big key piece here is that Options is going to take the $200,000 award from Clark County and leverage it into the Department of Commerce Housing Trust Fund round. So by bringing in $200,000 from Clark County, we can actually leverage that for almost $2 million from the state. So that's $2 million that we'll be able to bring into Clark County to develop these projects. And really kind of the model is to create that full accessibility so these individuals can age in place. The property that is in Battleground, the one Clark County house that they have in Battleground, which was developed with Clark County dollars, beautiful property. The 3 individuals who live there are still there from inception to now. So 7 years they've been living there. They absolutely love the home. I invite anyone to come out and see it. It's a beautiful place. I know some of you have seen it. And so the goal is to rinse and repeat. We want to basically do what the successful plan has done. And so that's what these 2 single family homes that we would develop would look like. Just on the last slide here, you'll see just kind of the full picture of what options will do with the support of the Clark County Award. So if you can go to the last slide, please. So like we talked about, individuals will have the affordability and accessibility to age in place. Through the Department of Commerce covenant, they'll be making a 40-year commitment to maintain this affordability. So this property will be affordable for 40 years. The tenants, to be affordable, they got to pay 30% of their monthly income. So most of these individuals are making maybe $1,000, maybe a little bit less a month. So they're looking to be able to pay rent somewhere around the $200 mark. And these individuals will receive 24/7 in-home support from VanCare. VanCare is a longstanding service provider in Clark County. They provide services for the 3 individuals at the Battleground property already developed, and they are extremely excited for the opportunity to be able to support 2 more homes in Clark County. Thank you very much for this opportunity again, and if anyone has any questions, I'd be happy to answer.
Thank you very much. Questions from the board?
I got a couple here. The first question would be I didn't pay attention when the slide was up because this came up later, but are there loans that you're procuring to help pay for this, or is it all like grant funding?
Yeah, all grant funding. So the 2 partners would be the Department of Commerce and would be Clark County. Foundation for the Challenge does put in some money as well for the operating reserves. But no, it's a combined project between Clark County and the Department of Commerce. They have a set aside for people with intellectual and developmental disabilities going into this next round. It looks like it's around 19 million. FFC was in the first half of the biennium. They actually just got awarded a 5-house project in the first half. And so this project would be part of the second half of that biennium.
Okay, and so then what would the rent go towards?
You're talking about like the rental income or so the rental income would be a part of the operating budget. Essentially, all the money stays with the house. The money doesn't leave the house. Contractually, it can't. So the replacement reserves and operating reserves will be preceded as part of the money that Commerce will put in, as well as FFC. And then the rental income will be used to support the operating budget.
Okay. And then my next question would be, when you say 3-bedroom single family homes, I'm trying to understand the structure there. Is that, I mean, I imagine that this is, you know, a place where individuals have access 24 hours to care. So is there somebody that is there 24 hours a day? Is there a bedroom for that person? So it's really only 2 bedrooms, or is it an additional space for people that are there to help take care?
Yeah, great question. So the 3-bedroom house is for 3 individuals with intellectual and developmental disabilities. The care provider, VanCare, typically they run 3 8-hour shifts. They have no property. They have no piece of it. We even tell them no office in the house. We really want it to be 100% the tenant's property.
Great. And then my last question, and I promise I'm not asking these to be critical of the program. I'm just genuinely curious.
Sure.
You know, it's $2 million for 2 units. And I'm curious, you know, what went into the decision to purchase and rehab versus new construction?
Yeah, it's a good question. We could probably go for a little while on that one. So I think the big key piece is that new construction requires a ton of extra work on the front end, especially with the Department of Commerce and what needs to be done in order to have an application eligible. And we do a lot of new construction, and it's not an unfamiliar model. Just depending on how we sort of see the lay of the land and what might be feasible when the certain local awards come into the pipeline, you know, is it reasonable for us to expect that we could get that load up done in time for application? In this case, we decided that the acquisition remodel method was better. We've already done it in Clark County as an acquisition remodel, and that turned out really, really well. And so I think we're kind of just going with the rinse and repeat method here. But we definitely do love to do new construction. And if we have enough lead up in time and we see that there's, a great piece of land that's in an area where services are available, absolutely.
Great, thank you. It's interesting. It's just kind of on display that sometimes all the rules and the regs and the hoops you got to jump through lead towards less efficiency overall in the system. But I appreciate your answers on that.
Yeah. Glenn, you and I could have a few coffee hangouts to talk about that.
Councillor Ferrer, did you have a question?
Oh, I was just, when looking at your pictures, I believe I just walked by one of these units the other day. Do you know if it's over off of 503 near Untouched Middle School?
These pictures here that you're seeing are, the one on the left is actually in Olympia. The one in the middle is Spokane, and the one on the right is Spokane. But the property in Clark County is right off of Main. And it's in, I think they call it like Woodland Estates now. I don't know what the exact neighborhood they call it, but it's right, it's probably just a quarter mile off of Main in Battleground.
Okay, yeah, because I saw a building that looked just like this, and it was near one of the schools in our area, and it was housed very nice. They keep it up. It has the main room, which looked like it could be facilitated for like arts and crafts, also as a dining area. And then it looked like, yeah, it could house, like you said, 2 to 3 people. So at the time walking by, I had no idea what it is until I saw your pictures and all that you were talking about today. I was like, oh, I think that's what it was.
It's very possible. That is the common model. We love the double common areas. You have 3 individuals who are living together. Some of them want their own common space. So having 2 common areas is really the gold standard that we go for with these properties. And then of course you'll see just, really nice accessibility features, either level entry, or you'll see, a concrete or a Trex ramping. So yeah, that sounds very familiar.
Any other questions from the board?
One other question. I'm sorry. We've seen so many presentations at this point. I feel like they might be crossing over. And I apologize if you've already addressed this. In what area would these 2 units be located within Clark County?
It's a good question. We're going to be obviously looking outside the city of Vancouver, but I think it's really VanCare and the individuals who are waiting for the opportunity to move into these homes. They are flexible to be anywhere in Clark County. So we're going to kind of let the properties at this point dictate where they're going to be. So we're going to look, primarily for the nicest, newest properties that are affordable. And that's probably going to start the search. So let's assume Clark County funds and then Department of Commerce funds will be right on the house search as soon as those awards are announced. And the best house wins.
Thank you.
All right, any other questions from the board?
Thank you.
Thank you, Jacob. We'll move on to the next portion. So the next section is a tenant-based rental assistance overview. And the tenant-based rental assistance programs will not do a presentation. I'll go over how our tenant-based rental assistance program works, and I'll provide you information about their applications, and you'll have time to ask questions. So Clark County's tenant-based rental assistance program operates on a calendar year with some flexibility, but typically starts January of the following year after awards are made. So applications for this round are intended to start in January of 2027. We use a rapid rehousing program model, which follows best practices for rate of success. It's cost effective, and it aligns with the Washington State Strategic Plan to End Homelessness. The program provides both rent and supportive services. Home funds are provided to provide rent assistance, so the subsidy for the tenants living in the unit, and then our CDBG funds are used for housing-focused case management and support services for that household. The program allows for up to 24 months of assistance. This is a HUD requirement that it is a time-limited program. And all referrals come through the Housing Solutions Center, except for YWCA, as there's a code that states that domestic violence programs can use their own access into the program. They are not required to follow coordinated entry. We do not have an application from YWCA this year, so all 4 of our applicants, those that are funded, would be using our coordinated entry model going through the Housing Solutions Center. Rapid Rehousing is a housing program with support intervention designed to help individuals and families quickly exit literal homelessness and return to permanent housing. Literal homelessness is when a household is living in either a shelter, a hotel paid by someone else other than that family, or in a place not meant for human habitation. It can also include persons fleeing domestic violence. So they may still be in housing, but they're actively trying to flee a domestic violence situation. So they would be considered literally homeless. Assistance is offered without preconditions. It's a housing first model. So they're not required to have a specific level of employment, income, free of criminal record, or be sober. The resources and services provided are tailored to the unique needs of the household. So our programs will work with each of the households they are in their program, create a housing stability plan, and then they will be working towards those goals to become stably housed. There's 3 main components to a rapid rehousing program. It's not required that a household utilize them all, but there is a lot of intense case management and discussions with the household on trying to meet that stability because the program is time limited. The 3 components include housing identification, rent and move-in assistance, and then those ongoing case management and services, or those supports. And we'll talk a little bit more about those in the next couple of slides. So housing identification is going to be where our housing providers are recruiting and working with landlords to provide housing opportunities for individuals and families experiencing homelessness. They're going to work with the households to address potential barriers to landlord participation, such as concerns about the short-term nature of rental assistance and tenant qualifications, and the households where there might have barriers such as previous credit history issues, if they have a criminal record, or if they have any evictions. They're going to work with the households on mitigating those barriers into housing and work with the landlords to help understand what the households are doing to mitigate those issues. The second component is going to be the rent and move-in assistance, and this is where the home funding comes into play. This provides financial assistance to help with the move-in costs, deposits, and rental and or utility assistance necessary to allow the households to move in immediately out of that homelessness situation and stabilize in permanent housing. And then the third and important component is the case management and supports. And here the housing programs are going to help those households identify and select among various permanent housing options based on their unique needs, preferences, and financial resources. This is where it's tenant-based, so they get to choose where they want to live. The housing providers are going to help those households address those issues that might impede their access to the housing, as I mentioned before. The providers are going to help those households negotiate manageable and appropriate lease agreements with the landlords. They're going to look for housing that will fit into their expected income so that they can then become stably housed once they exit the program. They're going to make sure that there's not inappropriate lease language in the leases with the households, those types of things. They're going to make appropriate and time-limited services and supports available to the households to allow them to stabilize quickly in that permanent housing. And then they're going to monitor participants' housing stability and be available to resolve any crises that may come up. And at a minimum, they're going to do that during the time they're in the Rapid Rehousing Assistance Program. But most of our programs often allow households who have exited the program to get in contact with the case management on a very quick, situation if they needed to help with a very quick support to make sure that they maintain that stability after they exit the program. That's often not providing any additional funding, but just providing the information and referrals to different supports to help that household. The housing providers often provide or assist the household with connections to resources that help them improve the safety and well-being and achieve their long-term goals. So as they create those housing stability plans, it may not always be, all the goals may not be specific to housing stability, but other types of services that are needed to help support that stability, which could be access to behavioral health services, employment supports, education, things like that. So they're going to help put those referrals together and get them connected to be able to achieve all of the housing stability goals that they have. The programs are also going to ensure that services provided are client directed, respectful of individuals' rights to self-determination, and voluntary. There is a requirement that programs cannot require households to participate in their services, in self-sufficiency services. So they cannot require that they attend or work on sobriety or employment goals. However, they are required to participate in that case management. So our housing providers can opt not to renew services to a household that is not engaging at all. And they do that at their determined recertification time. So that is a component of the program. So that is just a brief overview of our tenant-based rental assistance program and the components that all of our providers will be putting into the programs that they are designing with the use of the Clark County funding. The next few slides, we're going to go over each program, and they should have contacts here that can answer any questions from the board. The first program that we have is our Janus Youth program. And a little bit about the program. They've been operating tenant-based rental assistance since 2015. They are currently serving a specific youth age population, ages 18 to 25. They're proposing to serve 25 households. They've requested $225,800 in home funds and then a supporting dollars of $67,740 of CDBG funds to pay for those additional supports and case management services. In 2025, Janus had a program that operated from January through December. They proposed to serve 25 households last year. They actually assisted 14 households. And I will note that this increase or this request is an increase in funding from prior years that they have requested. Are there any questions for the board for Kiva with Janus Youth?
Rebecca?
Yes.
I was wondering if you could kind of review kind of repeat your comments again about like evaluating whether I missed the part about there's 24 months that TBRA can be administered. And then what were your comments about kind of like renewal? Can you repeat that again real quick?
Yeah, so the HUD home program has a limitation of 24 months. So any TBRA program can only operate and provide assistance for households for up to 24 months, with very limited exceptions to that 24-month time period. With our rapid rehousing program, all of our programs are really trying to get households into the program, into stable permanent housing as quickly as they can, and then have them exit the program as quickly as possible, making sure that they reach that stability phase. Once they've been in the program, they can be in there as long as funding allows, up to that 24 months. However, our programs do have some flexibility that if a household is not participating in case management services, they can opt not to renew at a recertification time. The home program requires recertifications at least annually. However, most of our programs operate more on a state timeline for recertifications, which is about every 3 months. Each program would identify what that recertification period looks like in their policies. They also indicate reasons for extending a person's stay in the program, or for having them exit earlier than that 24 months. And those policies are reviewed and approved by county staff.
Great, thank you for that. I was just kind of wondering, that the 24-month mark thing, and there's I'd be interested in hearing a little bit more about how we're making sure that people, I mean, you said, I think every 3 months or something. So is that like an income verification again? If people's income is increased, they will no longer qualify?
Correct. So the recertification is always going to include an income recertification to verify that they still meet the requirements of the program. And then the housing providers can assess if the household is participating in the program and opt not to renew if the household is just not engaging. Our programs really do their best to engage all of the households on a multiple times before they take the steps of not renewing any services with them. Households have to do the income recertification on the frequency that the housing provider has set in their policies. So if they don't engage and don't provide that income recertification, that is one primary reason they would be exited from the program. If they are not engaging in those stability services, just that engagement with the housing case managers, the housing provider does have the option not to renew at that recertification time.
Okay, so a couple things that come up for me on that is, one, I do appreciate us, making sure that we are using these funds for families that do qualify for them. Circumstances can change, they can find employment or get better employment, things like that. But I do have a couple of concerns, and one of them would be that, if their income rises and they no longer qualify, but they're unable to save enough money to pay for first month, last month, all of the fees that they have to pay to acquire their own housing, do we have something in place to ensure that people don't, that they aren't determined to no longer be qualified, but they can't secure their own housing on their own? Is there any way that we're looking at that?
So the tenant-based rental assistance program, actually, they are securing their own housing. They have a lease directly with a landlord. It's not nonprofit-owned housing. It's market housing out in the community. So they are actually, when they enter the program is providing those supports, that deposit assistance, move-in assistance, and getting the rental assistance and utility assistance all set up and going right in the beginning. When they exit the program, they actually stay in that housing as long as they're still meeting the lease requirements with the landlord.
Okay, great. That helps me understand that a lot better. And then my other question was on the other end, at 24 months, I think that this is, we have to walk a really fine line. We have to make sure that people are doing their due diligence to, creating self-sufficiency for themselves. But also with that hard deadline of 24 months, I mean, if a family is unable to get themselves into the situation where they can support themselves on their own without that assistance, do we have any programs that we kind of, that we work together in that scenario to make sure that people don't become unhoused simply, at the end of the 24 months? I just that I think the intent of that 24-month guideline is important because we're trying to, create incentive for folks to better their situation. But in the event that it doesn't happen, is there a safety net?
So the housing providers typically about 6 months before that 24-month deadline really start ensuring that households understand that the time in the program is going to come to an end regardless of their stability situation. So they really want to prepare those households to look into what other options that they have that they may not have been trying so far within the program. The other thing is that our programs work very closely with the Housing Solutions Center. Some of the programs that we run get other funding in the community. So they might get county funding through the Homeless Crisis Response System grants that we get through Commerce. And they are able to move households from the tenant-based rental assistance program into, if they have an opening, another funded program. They may have to do a reassessment for that household, and they may qualify for different levels of services. And if they don't have the ability to help that household within a different funded program in their agency, then they would work very closely with the Housing Solutions Center, and the Housing Solutions Center would do their best to work with any of the programs that are being funded through other grants provided in the community to hopefully move them from the current tenant-based rental assistance agency to a new or other housing provider in the community. So we do, as a system, work really hard to try to help those households maintain that stability, even if they time out of programs that don't have, that have a requirement for only a certain number of months of assistance.
Great, thank you for that. I think the stability is the most important part, and this is probably not the appropriate forum for this, but I would be interested in learning more about those different connections that are available, hopefully with the preference of not forcing the family to move, and, because that just removes all the stability that you've built over the last 2 years. So anyway, thank you for that information.
Any questions for Janice specific about their program? All right, not hearing any, we'll move on to the next program. So Lutheran Community Services is applying. This is their first time applying for county tenant-based rental assistance funds. They primarily serve immigrants and refugees. However, they're not going to only serve immigrants and refugees. They are proposing to serve 35 households. They are requesting $231,900 of home funds and $68,100 of CDBG funds to support the home program. Again, this is a brand new program for TBRA for this agency in Clark County or with the city of Vancouver. Are there any questions from the board? Not hearing any questions from the board. Staff do have one question. Your budget indicates that there will be no other funds available to administer this program. How will your agency pay for case management costs or other support services that are not housing focused, that are not able to be billed to the home and CDBG programs?
Hi, yeah, we have a multitude of other case management grants that we run in Clark County, and many of those are open eligibility, so not just restricted to what we call ORR, the Office of Refugee Resettlement eligibility criteria. So we would enroll clients in one of those case management services.
Thank you for that clarification. Any other questions from the board? All right, thank you. We'll move on to our next program. SHARE is applying to serve families and individuals throughout Clark County outside the city of Vancouver. They are proposing to serve 15 households with a requested amount of $230,770 of home funds and $69,230 of CDBG funds. SHARE has been operating a TBRA program funded through Clark County since 2005. In 2025, their program ran from January through December. They proposed to serve 15 households and actually served 13 households during the year. They were underspent in their award primarily due to staff turnover, but this year they have requested a reduced amount to ensure that they can expend all of the funds throughout this program year. Are there any questions for SHARE? All right, not hearing any. We'll move on to our final TBRA application. This is with the Salvation Army. They are proposing to serve families and individuals in Clark County outside the city of Vancouver. Their proposal is to serve 25 households. They're requesting $167,000 of home funds with $33,000 of CDBG funds for the program. They have had a previous award with Clark County that was operated between 2023 and 2024. The program took a little while to get up and running and didn't start until June of 2023, and we did have to extend their contract through September of 2024. They originally proposed to serve 15 households for that grant and actually served 9 households and were slightly underspent with their award, even with the extension. Are there any questions for the Salvation Army program? All right, not hearing any. We want to thank all of our tenant-based rental assistance programs for being here to answer any questions that may have come up from the board, along with all of our other presenters that have applied for and presented for the CDBG and home programs for our 2026 funding. Victoria, you have a question?
Yes, I do. Thank you. I'm trying to look at my notes and then look at the screen to see the descriptions and then the pricing. And so I do apologize for not having my question well ready, well rehearsed or ready to go. So Janice, for example, is looking to serve 24 households, and we see the dollar amount, and then we see SHARE looking to provide services or housing for 15 households, and they're requesting more. And now that I say this out loud, that could obviously, you see where I'm getting at, probably in regards to why is it less households is more, but then we're looking at families and adults versus Janice, who would probably be, you know, individual households, but then also maybe they don't need to be investing as much for grant funding because they've already received it from potentially other grant services. Can you help me with that one? Understanding if I made sense with that question?
Yeah, so the differences can be the types of households that they are assisting. The programs that have been around for longer doing tenant-based rental assistance have probably a little bit better understanding of how much funding they'll need for each of the households that they're serving due to the experience that they have over the last several years. But the biggest thing would be the population that they are serving and understanding the length of time that households will be in the program. The newer programs don't have as much experience with that, and they may be looking to serve households for a shorter period of time. However, once households are selected, they're referred by the Housing Solutions Center and sent over. These newer programs will get a better understanding of what time frame they'll need to be having, how much funding support they're going to need to serve the households to make sure that they do meet that stability. If any of the TBER programs would like to also address the response, you're welcome to come off of mute. All right, not hearing anything. Is there anyone else, any other questions from the board? All right. We will move on to our finals. Councillor Young?
Yes, thank you for all the work. Thank you everybody for coming and presenting to the board today. We completed the work a little bit quicker than we had anticipated, so that's great. So with that, did you want to mention the scoring technical assistance, Rebecca, or do you want us to just move on for the good of the order?
Yeah, so I do want to mention that we did new this year, we're set up a new scoring technical assistance session for the board members in the scoring committee. It's a drop-in. You don't need to, you don't have to be there, but if you have questions, staff will be there and available to answer questions. We originally were planning the session to be on February 23rd in the morning. However, due to scheduling conflicts, we needed to move that. So our drop-in technical assistance scoring session will be from 1 to 2:30 on February 23rd, so in the afternoon. To access it, just come to your link for your Urban County Policy Board meeting. That will get you in there. We will be there for you. Just another reminder that scores are due by Monday, March 2nd. If you haven't accessed the applications yet, please do so. You should have received 4 emails. One was from me that had all of your information that you'll need for doing the scoring, access to the funding guides, comments from staff on each of the applications, recordings from previous meetings for trainings on neighborly, things like that. And then 3 emails from Neighborly with your link to access the applications for each of the programs, one for affordable housing and homelessness, one for asset and economic development, and one for public services. Please make sure you use the links in those emails to access the applications. Otherwise, it won't let you, you can't just log in and have access to them. You'll have to use the links in the emails. If you need us to resend those, just let us know. We can do that for you. And again, we'll be there on Monday, February 23rd from 1 to 2:30 to answer any questions that you might have for doing the scoring. The final thing to mention is that our next meeting is our award recommendations. So we'll be putting together the funding memo. We'll have a better idea of how much funding is available in each of the categories, and the scores from all of the scoring committee and any recommendations that the board, that staff have for the board to make those award recommendations. Our next meeting is March 9th at our normal meeting time of 9:30 to 11.
Great. Thank you for that. And with that, we'll move on. And
I have a quick question.
Go ahead.
Sorry,
Go ahead,
the
Victoria.
hand raising button isn't up and running. Is it okay, Chair, if I ask a question?
Yeah, go ahead.
So in our situation here in Battleground, we just got a new mayor. I think you would have received the email update stating who the new the new members that were going to be representing Battleground on this board. However, I just got off the phone with our new mayor who may not be able to attend many of these meetings. So I'm assuming you probably need something in writing from him, or correct me if, as I need to know, who are you willing to accept the scores from?
So any of the mayor or any of the designated alternates can be on the scoring committee. And the new mayor has already responded to our inquiries about ensuring that we have those designated alternates updated, and that information is available on the website. And Victoria, you still are considered a designated alternate, and our understanding was you would be doing the scoring for Battleground. But if that changes, just let us know and we'll make sure that we get the information to the right person.
Okay, I just wanted to verify, because when I went onto your the Clark County website today, it had like a whole bunch of people when it should be just Mayor Overholser and myself as the alternate. So I didn't, just
So
wanted to
we
make sure.
didn't receive anything to requesting that we remove anyone else from the designated alternates, and all board members can have as many alternates as they would like to have. So if there is a change to remove any of them, we just need an email saying that they would no longer be a designated alternate.
Okay, okay. Thank you, I appreciate that. Yeah, because there was people, I'm like, like I know Councilmember DeRochers was no longer on the council, and in our minutes, there was some people are on there that were never approved. So I was like, I mean, it doesn't bother me. I was just curious how that got on there. So, okay.
They would have been approved through previous mayors.
Okay, okay. So that's why, and that makes sense, because you guys aren't requesting an update. You're requesting you would be requesting the renewal and any changes. Okay. That makes sense.
Great. And Rebecca, I was wondering if maybe you could send out a calendar event to all the board for February 23rd, but just put it in as optional, just so that it makes it easier to get into everybody's calendar.
Yes, we can do that.
That would be great. Okay, anything else for the good of the order? All right, hearing nothing, appreciate all your work today, and we'll be back again on March 9th to go over the scoring and awards. So thank you very much for all your work. You guys all have a great day.
Thank you, everyone.
Thank you.